We are family doctors.
We are nurses.
We are dietitians.
We are social workers.
We are evaluators.
We are pharmacists.
We're administrators, we're support staff.
We are your healthcare team.
And the team behind your team.
The people helping you build a healthier future.
We are patients.
We're also Albertans.
We're Calgary and High River.
Cochrane and Okotoks.
We are Banff and Didsbury.
We're Airdrie and Kenmore.
We're the Calgary Zone.
As a Calgary Zone, our vision is better together.
The Zone PCN Committee is really a collaboration between the joint venture partners, Alberta Health Services, the Alberta Medical Association, and so the physicians, and in particular we're talking about primary care physicians.
We've had a lot of good success in innovative projects that span all the PCNs and Alberta Health Services together. And we've used that to kind of push us forward in terms of new innovative ways of doing things to promote good patient care.
We know that the health of populations is improved through strong primary care. We know that strong primary care happens through medical homes that are equipped to deal with patients, their health challenges, health promotion over time. So the effort that we have in improving the patient-centered medical home will pay huge dividends down the road in health outcomes, patient satisfaction, and also cost reduction to the system.
PCNs have contributed a lot of resources and time and energy in regards to medical home implementation, to the extent that in the Calgary Zone we can say that we are working towards a unified approach to that.
We know that you're vulnerable when you're transitioning from home to hospital to home, so it's really important to maintain that information continuity so that the people that are helping those patients can help them manage their care. You can go on the website albertafindadoctor.ca and you can look to see which physicians are taking patients in your geographic area or whatever is convenient for you.
The idea behind Specialist Link was patients need better access to specialists, and family doctors have a lot more they can do in the medical home. So one way to allow patients to stay in the medical home and still get access would be through a phone consultation.
It was a big stress relief. No time off work, no having to go to another appointment, and no stress of waiting 9 months, year and a half, whatever it would have been.
My experience with Specialist Link is that patients really appreciate the extra level of care that I can give them in the medical home by accessing specialty expertise without them having to go see a specialist.
Primary care physicians, my colleagues, know that every day, almost every second patient visit has a mental health component. We also see the tremendous and significant suffering that mental health challenges cause, not just to the patient, but to their family and within the community. So this is a challenging issue, one that is best addressed by a team, and the supports that the PCNs and AHS are putting towards this problem is really important. I'm so excited to see the kind of passion and energy and creative thinking that happens when you get family physicians, PCN leaders and interdisciplinary team members and our AHS team together to really look at how we can develop programs to best support patients with mental health challenges. I see it in my office, the kind of support that I have now compared to 10 years ago before PCNs, and see the kind of improvement in patients' lives as a result of the resources that we're already investing, and I think there's an opportunity for even more care that just will result in positive outcomes.
I'm really optimistic about our chances of making a difference with regards to the opioid crisis, in part because we've had overwhelming response from physicians that this is work that they really want to be doing. They just feel they need a little extra support and some training on how to do it well. And You know, I think we've done a lot of great work in Calgary as a group, as PCNs already, and we're going to just continue to build on that.
I think we're going to see a seismic shift in patient involvement in their own care.
The patient needs to be there right from the get-go, and they need to be an equal voice, because you've got the experts who are trained in diagnosis and treatment, but then you've got me, who's an expert in my social and medical situation. So they have to work hand in hand, or you don't have the full outcome.
It's critical for patients to actually own their information and to be active participants in their healthcare, and I think the next 5 to 10 years will definitely show us much more ability to achieve that.